On our radar today, the government has told the parliament that India has set its own air quality standards and WHO guidelines are only advisories meant to help nations frame metrics. In a written reply in the Rajya Sabha, the Minister of State for Environment, Kirti Vardhan Singh, today said that global air quality rankings cited by various organizations are not conducted by any official authority. He added that the World Health Organization's air quality norms serve only as advisory values and are not binding standards. A report by Switzerland-based air quality monitoring company IQ Air earlier this year had highlighted that 13 of the world's top 20 most polluted cities are in India. Lok Sabha Leader of Opposition and Congress MP Rahul Gandhi has called for an urgent and cross-party debate on the worsening of air pollution crisis. The centre has agreed to conduct this discussion. To take this ahead, we're now joined by Amit Bhatt, the India Managing Director for International Council for Clean Transportation. Mr. Bhatt, thank you so much for joining us. Again, first question. These are some very credible indices that we're talking about here. The IQ Air World Air Quality Rankings, the WHO Global Air Quality Database, the Environmental Performance Index, Global Burden of Disease. These are very highly reputed and they are very widely considered indices across the board when it comes to policy making. India seems to, however, not too keen on accepting the findings. And that's one consistent finding, that India is, in fact, some of the cities here are some of the most polluted. Reasons why you think the government here is not too keen on accepting the findings of some of these very credible reports that have been put out in the public domain?
Absolutely, Ashmit. I think if you look at even the global air quality standards that countries have, and these vary across geography. So, for example, if you look at so what WHO says is in terms of the guidelines on particulate matter 2.5 exposure is about 5 on an annual standard level, and about 2 on 24 hours basis it is about 15. And if you take that number and compare globally, it varies across geographies. And so the reason is that so if you have to fight air pollution, it has to be a long-term fight, a sustainable fight, and it requires a lot of action. And sometimes it will take time. Sometimes the decisions may not be very kind of forthcoming, but I think the action has to be all around the year. But again, as I said, the variations are there across the geographies. But again, if you look at closely the data, the standards are very stringent, especially in the developed countries as compared to developing countries.
Just one follow-up question to that, Mr. Bhatt, that when we look at these findings, they're not terribly inconsistent with what we experience on a daily basis. Even when we have our AQI monitors at home, some of the AQI sensors that are publicly available, it is not inconsistent with that. Is this something that the government now needs to reconcile with, that the findings of these reports may be extremely damaging for India's reputation, but it is consistent with the situation that we have actually on the ground?
Absolutely. And that's what I was trying to allude to, that if you look at findings, even from the low-cost sensor data that has come from many various cities, the findings are pretty consistent that air quality is pretty bad in Indian cities. While it is severe across the Indo-Gangetic plain, yet if you look at a national level average, I think almost cities that have air quality data, almost 70-80% cities require almost 50 to 70% reduction in their particulate matter exposure, even to meet the Government of India guidelines. And if you look at the WHO guidelines, then all the cities actually fail to meet the WHO guidelines. So I think it is very consistent, but I think we have to understand that air pollution fight is a pretty systemic fight, where you have to look at a regional approach, an airshed approach. Only then the action will happen. Sure. It is not limited to action in cities or just one or two geographies.
One common finding that comes to us through medical professionals is that the air quality levels that we currently have, say, for example, in the national capital, will have very severe, long-lasting implications for one's health. However, the rationale that seems to be coming from the government is that there is no conclusive data to establish direct correlation between death or disease and exclusively pollution. Again, is it a case where we're not using the right data points to inform policy decisions? Is there a better data management system that we need, at least when it comes to sensitive issues such as air quality management?
No, absolutely. And again, so if there is no conclusive air quality data which links public health to air quality, I think government can absolutely fund a study which can throw this data. So, and we have pretty well-established organizations, government institutes which can do this. So that's absolutely doable. But again, if you look at anecdotally, and if you look at things like asthma, pulmonary diseases, even in the kids who are taking leaves from school, especially certain time of the year, you will find a very stark correlation between deteriorating air quality and public health. So we have very strong empirical data, even a lot of anecdotal data, but there is always a possibility to fund a scientific research and get the data on board and take some action on it.
Right, Mr. Bhatt, thank you so much for joining us. Clearly, this is an issue that doesn't need a red flag, but a number of indicators pointing in that direction that we're clearly not doing enough. There is a comprehensive solution required going forward to this air quality crisis. Mr. Bhatt, thank you once again for joining us on the show. But with that, we're slipping into a very short break. But coming up, a U.S. ambassador to India says that the telephonic conversation between Prime Minister Modi and President Trump was a great call between two friends. A special conversation with Pramit Pal Chaudhary of Eurasia Group when we return on the other side.
"26 years of CNBC-TV18